Hello, everyone. And oh, it says my browser's lost connection to my camera. What the? Are we live? I hope so. Nope, I've lost the camera. We are live, but we're having some technical difficulties. Just a second. There we are. Welcome back. Hello, everyone, and welcome to the Mental Health Warriors. I'm Annette Chappie. I am your mental wellness warrior, and today I have a very special guest. So I hope I don't see us in the picture. Something's not right. There's always these technical difficulties.
There always is. There always is.
Yeah.
Difficulty with technical stuff.
It's recording. Why are we having so much difficulty? I wonder if I have the wrong thing here. The overlay. Nope. Just bear with us, folks. I might have hit something wrong. Having issues. Said the camera wasn't working.
And it's funny because we can see us down in that little one.
Yeah, and it should show up there.
Maybe if you click those three dots.
Where?
Right here. What does that say?
Edit name.
Okay,
edit.
no.
Stop mic cam. No, we don't want to stop it.
I don't want that. Maybe in your settings?
Well, I had my camera open earlier. For some reason, chat with us.
We're going to figure it out.
Well, people can hear us. So how are you today, Lynn?
I'm good. I'm in this lovely space, so I can't wait till everyone else can see it.
Yeah.
We're in a greenhouse, which is amazing, even though it's gray and dreary outside here.
I know we've had a lot
inside,
of rain.
Certainly is lovely.
Yes. I keep it nice and toasty warm here. Well, we have our technical support here. He says, do you have the right camera selected? When you click on settings at the bottom of the studio, then click on camera. And click on camera. Do you see the camera you
settings? Go to settings.
Yeah. Go to settings. Camera. No, there's only one camera. Mirror my camera?
Try that maybe? I don't know.
I have no idea what's happened. Do you have the right camera selected? There's only one camera. Sorry, folks, about this. I think people can hear us. So, Lynn, tell us a little bit about yourself while we're waiting for camera to come up.
Sure. So my name's Lynne Raimondi, and I work with the Canadian Mental Health Association in Simcoe County, so in Ontario. And Canadian Mental Health is a national brand, so we do have branches across Canada. And I work in the fundraising, volunteer, and communication program. I've worked there for over years. Spent lots of my career as a frontline mental health and addiction counselor. And then probably in the last 7 years, that's when I transitioned into the role I am now. So I able to do these kind of exciting things, which I love. I love, being able to train and educate people about mental health, addiction, and what we do at Canadian Mental Health. This week actually is our CMHA Mental Health Week. So it's an awareness week here in Canada, where we want people to, promote mental health, talk about mental health. And this year, the theme actually for Mental Health Week is my story. Hashtag my story is what they're using. And the idea behind the theme is that when people share their stories, and we all have stories, right? We all have lives that may have been affected in one way or another by either mental health or addiction, or we know somebody that has, or we've been through hard times. Certainly we know that mental health difficulty and addiction does not discriminate. So it doesn't matter, what job you have, or what your income is, what kind of car you drive. No one is immune to experiencing, a mental health issue or an addiction issue. So the idea of hashtag my story, which is the theme for Mental Health Week this year, is that when we're able to share our stories and when we're able to listen to others' stories, we are helping to, empathize and understand what people are going through. And we are able to break down the stigma that still does exist. Unfortunately, it's getting better, of course, but the stigma is still there for mental health and addiction. So when we share our stories, we're able to educate people. We're able to, like I said, empathize and, understand where people might be coming from in their lives at that time.
I wish I could have listened to that more closely, but it's more important the viewers could. We solved the problem.
The camera.
Oh my God. I had the overlay on top. I thought I was trying to adjust the background before.
Okay.
And what happened was somebody had left the previous overlay on, and I changed it and thought I had the correct one. And
You fixed it.
I
That's all that
had a
matters.
boo-boo. I'm so sorry.
It's okay.
So let's go to comments and see if anyone is listening or talking to us. All right, so we're fine for now. So that was amazing.
Yes.
I want to play the intro because
we always do that.
And I always have technical difficulties from time to time, and there's nothing to be embarrassed about that. Okay, we'll be right back after our intro. And we're back. Thank you, Lynn, for filling in the audio part without camera for me.
No problem. No problem. Happy to share why I'm here. And again, thank you, Annette, for inviting me. This is my first podcast, so I'm excited.
Nice. So we met when I wanted to donate directly to the Canadian Mental Health Association in Simcoe County. Previous to that, I had been donating directly to online, not knowing that I was giving to the national umbrella of the Canadian Mental Health Association. So you said to me, if I wanted to be able to affect more families in the more local community, to donate directly to you, to your office. And I was grateful for that because I had to use your services way back when I went homeless for a very short stint. And that was way back in oh God, 2014, 15. I can't remember exactly when. And I was in the hospital, and I was previously staying at the shelter, the women's shelter in Barrie.
Mm-hmm.
And for my episode I had there, I had a very psychotic break, and they felt they couldn't help me anymore, and that I might have been a danger to other people. To think I was that ill, it was scary.
Mm-hmm. Absolutely, that would be.
Yeah. And so when the hospital wouldn't admit me, they said, go to the Canadian Mental Health Association. So they sent me to you guys. And thankfully, I was able to get shelter and then put my self together, get through the anxiety I was struggling with. And I got a very good friend on the phone, and she ended up housing me for a short while. But just that small hiccup in my life and being able to rely on the Canadian Mental Health Association made like night and day for me, instead of being on the street, right? I don't even think I had a car at the time, right? So I couldn't even sleep in the car. So when people reach out to the Canadian Mental Health Association, you must get like tons and tons of different situations that are happening. What do you find is the most common thing that's happening out there with mental health these days?
Well, firstly, I want to say I'm really happy that you had that good experience with our services. Certainly, that's what we strive for. We strive to deliver, the best service possible for the client, so that we can get that client, moving forward, help them to, reach their goals, whatever those goals might be, and support them, exactly where they're at. So I'm really happy to hear that you were able to get back on your feet and look what you're doing now. I mean, it's incredible what you're doing, right? I'm not sure if there is a more common thing that that people ask of us in terms of wanting service. I think now it's so many things, right?
What about COVID? I hear a lot of feedback about, oh my God, people are struggling so badly with their mental health since COVID.
Well, certainly we have seen, an increase in demand for service. Since COVID, there's no doubt about that. And during COVID, it was difficult, right? We never stopped delivering services, our essential services,
Right.
which are our crisis services, our ACT teams, our assertive community treatment teams. They never stopped working. Our case managers and our counselors went to delivering services online, virtually. And the good thing that came out of COVID was that we still deliver those services virtually, because people like it. Some people, they don't want to go to an office. They would rather stay at home. So we still offer that, which is wonderful, because prior to COVID, we didn't offer that, right? So that's one really great thing. We are serving, people that don't want to attend an office. So I always say that there are some positive things that happened.
Yes.
But certainly, we have so many programs. So we have people that come to us, for crisis support. So they have something that's happened in their life that has, put them into a crisis, either that they're homeless, or that they may be losing their job, or their family. I'm not sure what the situation is, but it's a crisis for them, right? So we have services for that. We have court services. So we have services that support people that are going through, through the court system. We have a social recreation program, so where people can go and learn new skills. We have addiction counseling, we have mental health counseling, we have some youth services. So I'm forgetting some because we have so many, but we have a variety of programs that are delivered to people depending on what their circumstances. And I think that nowadays, it can be anything. And if we can't serve the person because we don't have the proper program, we have, a great team that will refer you to the right place, depending on what your situation is.
Right. Well, that's it. That's very involved and detailed services that you can provide.
Yes, and our programs have grown like exponentially, in the last 20 years. We have so much available for people, and we try our best, to keep our wait lists very short. Our services are free, so there's no cost for our services. And the client needs and the needs of them and their families are always at the forefront.
Yeah. So when you described that you are the manager of volunteers, are you getting the necessary amount of volunteers? Are you under, like, would you like to see more people come out and help?
I mean, so we actually, we just got the volunteer program just under a year ago. And so obviously during COVID, it was difficult, right? There was no events. We weren't doing in-person things. So our volunteers weren't doing much at all during COVID. But now that we're back to, delivering services in person, our doors are open for people to walk in our buildings, and we're doing groups again, and we're having events. We do need volunteers, and we are getting volunteers. It's great. Like I probably get, 2 contacts a week of people that want to volunteer with us. So it's incredible.
Nice.
But we always need more. Absolutely. Volunteers are so important for us and for our services. So yeah, we always are in need of new volunteers. We have, obviously lots of students that want to volunteer with us. But when their return to school comes along, they're going back to school. So yeah, so it's kind of always rotating, right?
Right. And the fundraising stuff that you do, like I know that I've taken it upon myself to do as much fundraising, and I do raffles, and I do a portion of the sales for my coloring books and cards and services. And I donate that yearly to you guys. So what else is involved in somebody helping you with fundraising?
So yes, Annette, and we thank you so much. You're an incredible donor to our organization. What we would describe you and others as, we would describe you as third-party donors. So you're a person that runs events and fundraises and then donates back to us.
Right.
So we have many people that do that, which is amazing. I always think it's incredible when people use their free time to run events or do these types of fundraising things, because they're not easy. They're a lot of work, right? We have so many people like you that are passionate about mental health and mental health awareness, and they just want to help, right?
Right.
So we're in the community, supporting all the people that run our third-party events. Like yours, we'll be there for your event that you're going to talk about in the summer.
Yeah, I'm really grateful that you're coming too.
Yeah.
I've always wanted a representative to be at my fundraiser so that people could talk, because I've had people literally, sorry for interrupting you.
Yes, no.
I've had people literally stop me while they're visiting the yard sale and say to me, well, I would like to be able to get in contact with somebody, or this is my story and I would like to share it. And I'm like, well, I'm trying to run the fundraiser. I would love to sit and listen with you, because I do the mentoring and the listening as well. But if a representative was there, right, then they could talk to somebody directly at that time. So there's that development happening.
Yes, and we just believe it's so important to support people that are supporting us, right? And to, like you said, to be there for the attendees, the participants, if they want to come and talk, if they have, a question that they want answered, or they want to know more about a certain program or a resource that we offer, we absolutely will do that. And that happens a lot at our events, right? That's where we make more connections with people. And that's what we want to do. We want to make sure that the community is aware of exactly what we offer and how they can access those things. Yeah. So we have the third-party fundraisers. We also run 2 major fundraising events a year through Canadian Mental Health. So in the fall, we did a gala, and we did that gala for our youth program.
Yes.
And coming up in June, we are doing our golf tournament. which we haven't done since 2019 because of the pandemic. So it's exciting to get back to that again.
Yeah.
We have a wonderful following for that event. So
I'm gonna tell my son-in-law to go to that because he's a real
anyone
avid
that loves
golfer.
golf.
Yeah.
We hold it at Tangle Creek. All the information's on our website. So
Yeah.
yeah, it's another great event that we do.
Nice.
Yeah.
And your other part of what you do is communications. What does that entail?
So that really entails a lot of our website work through Canadian Mental Health and our social media accounts, preparing publications or documents, that kind of thing. So that's also new to our role. So we're always learning how to get better at that. And yeah. How to make sure our brand, our CMHA brand, is represented properly in the community, and we focus on making sure, like I said before, that people know about Canadian Mental Health. They know who we are, that we're a community organization committed to supporting individuals that have mental health and addiction issues in their community.
Yeah, very good. And so what brought you into the mental health field? Why? What was your passion? Did you experience your own story in life or family member? Now, if I'm too personal, you don't have to answer. I always tell people,
you're totally fine,
because that's how I came to be here.
Yes.
Right?
Certainly that's how I have stayed in the field. But funny enough, that's not how I came into the field. But when I was a student at Western, I was taking psychology, and my goal at that time was to become a teacher. So that's what I thought I was going to do. So when I was in school, I was looking for a summer job, and I got hired at a hardware store. And I really didn't like it. I was not good at remembering all the codes for all the nails and everything on all the screws, and I just wasn't doing well in that job. So I was thinking to myself, I need to find another job. I can't do this all summer. So I went on at that time Human Resources Development Canada, and I found this summer job of what they described as a life skills worker with Canadian Mental Health.
Oh, yeah.
And at that time, our branch was very small, like only 20 staff. So it was a small branch. We only had, I think, 2 programs. So I went to the office with my resume, and I was able to get that summer job. And I would say I was probably pretty sheltered when it came to knowing about mental health at that time in my life. Certainly that was a long time ago. When people weren't talking about mental health, right? We're talking about, this is in the 90s.
Yeah.
So it wasn't talked about much. People weren't sharing stories, right? So I would say I was very green. And I had a wonderful experience that summer with Canadian Mental Health Association, and learned a lot. So I was able to go back to that summer job for a few years. And when I graduated university, I had applied to Teachers College, but I didn't get in. So I thought, okay, I'll take a year off and I'll apply again next year. And then a full-time job opened up with Canadian Mental Health as a case manager. And I applied for that job. I got the job, and I never left. And I never went to Teachers College because I loved the work and I loved the organization. And I would never do anything different.
That's beautiful.
Yeah.
That's beautiful. I've always been curious about, is there a part with the Canadian Mental Health Association that focuses on like how the Mental Health Warriors does about ending the stigma? And give us a little bit of feedback about what that looks like when people are approached, when you talk about it. Do you find it prevalent in when you're treating somebody that there's a stigma? What is that kind of? Give me a little bit of background on that.
So certainly breaking down the stigma and working towards ending the stigma is something that we have always had as a top priority. I think that
have you come a long way from
yes,
20 years?
I believe, because I've seen it.
Yeah.
I'll tell you where I've seen it the most.
Yeah.
Is we will go into school. So we just went to actually a school today, a high school, and did a presentation. And we're doing one tomorrow as well. And we've done school presentations for many years now. And we even do some presentations to elementary schools with our Talk Today program, which is a partnership with the OHL and CMHA Ontario.
I think I've heard of that.
Yeah, it's a really cool program.
Yeah, because I follow a lot of hockey.
Yes, you would know about it then. Yeah. So what we learn when we go into the schools is that the youth of today, they know about mental health.
Yes.
They know the signs, they know the symptoms, they know how to help somebody. And those stigmatized words, they don't use those words. So it's funny because we will ask, when we teach grades 6, 7s, and 8s, we'll ask, what kinds of words do you think about? What comes to your mind when you hear the word, when you hear the term mental illness? Mm-hmm. And they don't say crazy. Yeah. They don't say nuts. They don't say those typical, stigmatizing words. They use words like sad, anxious, depressed, not okay, right? So they're using different words than we used 20 years ago. Nice. Right? So that's a good thing to know. It's amazing. It really fills me up so much, and it gives me so much hope. Yeah. That it's that generation that is going to help to move that stigma out. Yeah. Right. And also, I think a really important piece is when we hear, just give me a, go ahead. You can keep talking. Okay, I'm going to read Robert's comment here. When we hear a lot of celebrities and, high profile sports players, people that are in, highlighted in the media, when they talk about their mental health struggles or their addiction struggles, right? It normalizes it, and it says to people, this can happen to anybody. Right. Right. It doesn't discriminate. No, it's not that homeless person on the street or, the person that's using drugs. It can happen to anyone at any time of their life. And what we need to do is learn how to protect our mental health. Yes. Yes. Yeah. And that's why my show called The Power Hour Self-Care is because protecting my mental health has been the number one priority in my life. And making it the number one priority in my life, I recognize just how human I am about any little thing can stress us these days. It can be traffic. It can be a death in a family. Mm-hmm. It could be your loss of your job, whatever the case may be. But for me, it can be as simple as I've been struggling for my entire life with an eating disorder. And I'm finally wrapping my head around the fact that part of the reason why I have an eating disorder is because I still have a tiny bit of behavior patterns that cause me to make myself ill mentally, mm-hmm. because I think about it in the incorrect ways. So I literally have to structure my day to do a lot of self-care from beginning and then at the end. Mm-hmm. And I constantly check in. How am I feeling? I'm not okay. Why am I not okay? But that took so much learning from all the wellness practices and the books I read and the talking with. I mean, there was a point in my life where I was on the crisis hotline, not to commit suicide. Mm-hmm. And thank God you had a hotline crisis, crisis hotline. Yeah. Because maybe I wouldn't have made it if it wasn't there. Mm-hmm. Right. So talking, like I describe to people when it comes, let me just see what Robert has to say here. Is you
He's talking about what he's up to.
Oh, okay.
I thought he had a question. It is using those tools that I learned from therapy and from listening to the people I talked to on the crisis hotline that reminded me that I wasn't alone. Right? Having the association and having the network of people that I built around me helps remind me that I can reach out, but at the same time, I also have to reach in.
Yes, and that's what I was going to say. I mean, it's wonderful that you have had support, you know, from our organization and from others. But I think it's important for you to remember all the work that you did as an individual, right?
Yeah.
To be able to reflect on, this is how I can get through this. These are the coping strategies I'm going to use, and to have that insight, right? It's a lot of work.
Yeah.
And it's a lot of, you know, mindfulness and getting to know yourself better. And we talked about that today with the kids at the school. We said, you know, it's really important to pay attention to your body and to your stress level so that you can manage your stress and your pressures, because we all have pressures and it doesn't get better when you get older, right?
Yeah.
But if we can just be aware of our body's responses and our actions and our behaviors related to that stress, then we can try and learn what works for us, right? Because what works for you is not going to be the same thing that works for me.
Yeah, we always talk about that.
Yeah, and all of that insight and that reflection, it's a lot of work. It takes a lot of work.
I definitely thought when I started creating my coloring books that you know, I was going to change the world. So, you know, when you get this vision, okay, so here I was going through life and I'm imagining that that my mental health was great. Like each step that I had, because I had various bouts of depression and then various bouts of anxiety. And each time I dealt with that specific area of my life, I was able to cope with it the next time like 10,000 times better. Right?
Great.
So recognizing that mindfulness is so important. And putting the focus on mental wellness has really turned a page for me, talking about it, like doing speaker events. So I described to people that through my journey, it was like I was diagnosed with mental illness. And then I recognized I needed help for my mental health. And then I worked from the realm of mental health, working on it, into the realm of mental wellness. And I love that diagram, explaining it to people, because people get a light bulb. They're like, oh,
yes,
I don't have to remain in being mentally ill. And I always explain to people that, you know, there are some mental illnesses that are not where you can go to the realm of mental wellness. You just have an illness that is something that is usually involved with the brain or something. And I don't even try to talk about that. I don't understand it, to say the least. But when it came to understanding that I had a team of people that I could rely on, that was so encouraging. And that's why I wanted to give back to the Canadian Mental Health Association. And having you come on and describe what's going out there in the community. And sometimes I get mixed feedback, right? And when I get that mixed feedback, I kind of look at it as along my journey, I've had people that are like so enthusiastic about getting help for their mental health. And then other people that just want to stay in victim mode, right? And they just want to feed their illness, per se.
I think it's really hard, and I love how you described that, Annette, because that's another thing that we're moving towards. You know, I would say in the last few years, is really focusing on that mental health and wellness, because we know that 1 in 5 people will experience a mental health difficulty or a mental illness throughout their lifetime. And when we talk about a mental illness, we're talking about something that's more serious than mental health, right?
Right.
But everybody has mental health, right? 5 in 5 people have mental health. So we all need to take care of our mental health and wellness. And we need to protect that because we all have a brain. So we all have mental health.
Right.
So we are encouraging people to, focus on mental health, because throughout their life, as anybody will experience, difficult times, like you mentioned, the death of a loved one, perhaps, a broken family, friendships that, there may be issues, the loss of a job. There's many things that, can affect our mental health throughout our lifetime, right?
Yeah.
And if we don't know how to protect it and take care of it, then it can turn into something more serious.
Yeah.
So we are, we certainly serve, the mentally ill, and we have credible programs, for people that need a lot of care and need that support.
Yes.
But we also are focusing on how do we keep people well,
Right. Yeah.
How can we support people to take care of themselves to a level that they're going to take care of their mental health, so that they're not going to get ill, if that makes sense.
Yeah. No, I love that you shared that, because I kind of had this ignorance, I guess you would call it, about how people would be processed through the Mental Health Association. Like, now that you've explained that you have a realm of help for those that have a mental illness, where I can't explain it the way you did. It was great.
That's okay.
But it's informative for viewers to know that there's different levels in the mental health awareness, mental health association, that deal with different aspects of where we are with our mental health.
Yes.
So you do deal with the illness, the health, and the wellness.
Yes.
Part.
We want to deal with the whole person.
Right.
Right. We want to deal with that kind of whole spectrum. And we want to help somebody that wants to attend a group so that they can perhaps increase their self-esteem, for example, right?
Yes.
Because self-esteem, we know, is related to our mental health.
Yes.
When we have low self-esteem, our mental health suffers. So we want to be able to serve that person.
Yeah.
And we want to serve the person that may be struggling, needs to have someone visit them in their home 3 days a week, needs support with their medication, needs support with their doctor's appointments. We also support that person. So because mental health and mental illness looks different for everyone, it's so individual.
Yeah.
So
I didn't even know, like, to give you a little bit of background on myself, I didn't even know that I had post-traumatic stress disorder until I was diagnosed by my doctor. Now, that might be a common thing, that people don't know that they're struggling with a mental illness. But I just thought that I was very unhappy, and that life was just like this, that you go around life being miserable and complaining and blaming everybody, and being ill physically because you just can't get your stuff together. And but once I had that diagnosis, once the doctor confirmed that I wasn't just being unhappy, it was that I had trauma in my life that I had to deal with, I could take charge of my life and reach out to resources. And I thought that was very key in recognizing that I didn't recognize that I wasn't looking after my own mental health, because I don't know, maybe it's things are changing, like you're talking about the kids and they don't use the words with stigma. But growing up, I remember nobody talked about their mental health. People rarely talked about addiction, because I remember, oh, he's just a drunk, or, I didn't even hear about drugs until I was much earlier. But it was eye-opening, to say the least, that I had post-traumatic stress disorder. And what do you do with that, right? So of course, I went and looked at the main thing in my life that affected it, and I went to Athena's. And once I started dealing with the core issues, then I was able to deal with, how do I get mentally healthy, right? And then there was no turning back, right? There's no turning back. And I hope that happens a lot with people that walk through the doors of the Canadian Mental Health Association.
I certainly can't speak for everyone. We have so many clients and so many programs, and we're across Simcoe County. So we're not just in Barrie, we're in Midland, Collingwood, Orillia. But I would hope that, a person that leaves our organization truly believes that they were helped, because certainly that is, that's always our goal, is to make sure that we are, that we're helping someone in the best way possible.
Mm-hmm.
Yeah.
Mm-hmm. So where do you think will be, there's two more comments here. Where do you think mental health is going a few years from now? Like, what's its trajectory with helping the public?
That's a good question. That's a really good question. I can, try and guess. I think that there's a lot of focus nowadays, and I think it will continue around, that self-care piece. So you talked about it as well. Recognizing that self-care needs to be a part of your routine.
Yes.
And self-care, again, it's not just, oh, I'm going to do a self-care day because I'm going to go get my nails done and my hair done, or I'm going to do a self-care day, I'm going to, go for, I don't know, a motorcycle ride, whatever it might be for that person. It's not just one day.
Yes.
It has to be part of your routine on a daily basis, right? Yes. So looking after yourself as a whole person. So, thinking about, what are you eating, right? So are you eating mostly nutritious foods that, make your body feel good, that give you energy? Sleeping. Mm-hmm. Are you sleeping enough, right? Because, there's so many responsibilities nowadays that everyone has, that sometimes it's hard to get a good night's sleep, but it's so important, for your self-care and for your mental health, right? And for your energy level and your motivation. And then finding those hobbies, interests, or people that bring you joy, right? That can provide you with a distraction from your problems. Because I'm not saying that, no one can say that there's not going to be any more problems, right? There's always going to be problems. There's always going to be issues. There's always going to be things in our lives that cause us stress.
Yes.
But it's how we are able to manage those things, so that, again, we aren't letting our mental health get to a level that we're not able to control it anymore.
Mm-hmm.
So, whether for you it's exercising, or, making sure that you cut space out of your day for meditation, for reading, whatever that activity, or whoever that person is that provides you with support, to make sure you build time for that in your day, right? And not letting that self-care get pushed to the side.
Mm-hmm.
We always talk about how we look after our physical health.
Yeah.
If we have a toothache, we go to the dentist. If we break our arm, we're not going to just leave it. We're going to go to the hospital, and we're going to get, right? We're going to get it looked after. Unfortunately, we don't think that way always about our mental health, right?
Yeah.
So, trying to change that thinking, that we do need to take care of our mental health as much as we take care of our physical health. Mm-hmm. So important.
So maybe there's a bit of a stigma around self-care.
For sure. Because sometimes self-care can be like thought of, I don't know, this is just me in my own personal opinion, as I'm a mom of two girls that, I love, and I devote so much of my time to, and sometimes I feel guilty, like if I'm doing something for myself, right? Like if I take time away from them to do something, or I think to myself, oh, I should be doing this, I should be doing a chore, or so sometimes we can think of self-care as a selfish thing.
Yes.
Yeah. So we need to change that too, right? Because self-care is not selfish. It's something that we have to prioritize.
It's almost essential as eating a good meal and getting your sleep.
Absolutely.
For me, I know it is.
Absolutely. And whether it's, like I said, it could be 1,000 things, and it could be different, and it's different for everybody.
Yeah.
But just trying to reflect and recognize, either when you're with somebody or you're doing something, like, yeah, this, I feel more calm. I feel more relaxed, and looking, I should do that more often, right? Because I feel good.
Yeah, absolutely. Yeah. I mean, my self-care is very involved. And when I let it slip, I notice I start to get that feeling of, I feel depressed. I feel anxious because I'm not in the present moment enjoying the things that I love to do.
Yeah.
And I really love looking after myself because it just seems to ripple out there, and people will see it. They see you and they feel your energy and they're attracted to that.
Yes.
And it just makes the whole world feel better.
Absolutely.
Right? Because I'm feeling better, people that I'm affecting around me feel better.
Yeah.
Right?
For sure.
And well, I'm so grateful that you are going to be here during my fundraiser so that you can talk to people.
I'm excited too. So why don't you talk about the fundraiser?
Oh, okay.
Yeah.
So I have put together my 3rd annual fundraiser to raise money for the Canadian Mental Health Association here in New Lowell. And it's going to have some people that are like-minded come, as well as yourselves, have a table here. And what I always do is I get people, and please do so, contact me if you would like, donate things, household items, their time, whatever it is. But the more items I have to put up on the tables, the more money I raise, because it's 100% of the proceeds goes to you guys. And
it's amazing. So it's like a big yard sale.
Yeah.
Oh, okay.
Yeah. The only money I actually take away from it is if I sell some of my coloring books. Right, I make back the money I put out for making them, a little tiny bit of profit, and I give $2 from each book.
Wow.
So, for me, it's always about raising awareness. The support, the awareness, get people talking, and the sale is running from July 7th, which is a Friday, through the whole weekend to the 9th. On Sunday. Nice. And I usually have it from, people stop as soon as I start setting up the tables. It runs from 8 till 5 each day. And that makes a long day.
It's a long day. Yeah. Especially if it's hot.
Yeah. Right. Usually the weather has been very cooperative. I don't know about this year.
Well, that's nice.
It's Elizabeth. Hi, Elizabeth. Nice. How are you, honey? What'd she say? Amazing work you do to bring awareness. Thank you. And that's same with the Canadian Mental Health Association. Liz and I have known each other. She also has her own podcast. She gets people on that talk about what they're doing out there in the community, the various authors, organizations from all over the world.
Oh, wow.
Right? And she promotes them and gets awareness out there about new help, new products, stuff like that. She's incredible. That's been on her show a couple of times. And her show's called T, so it's Teach, Education, and Awareness. I believe it stands for TEA. If I'm wrong, I apologize. Trying to think of it off the top of my head. How are we doing for time? Oh, we're pretty good.
A little bit more time, yeah.
So, what else did I wanted to?
Your fundraiser. So were you done about your fundraiser?
I think so. It's going to be big and bad this year.
So how do people donate to the fundraiser? Like how do you get items? Do they drop them off, or how does that work?
Yeah, I ask, usually somebody that's moving will donate stuff, and I ask them to drop it off. Like this weekend I have a pickup I have to do because a girlfriend of mine, unfortunately, but fortunately for her, she's leaving Barrie and she's moving out west.
Okay.
And she's got a whole bunch of stuff for me. And so I'll if it's local, I'll pick it up. If not, I ask for people to try to donate it, like deliver it here
Yeah.
about 2-3 days before, so I'm
Right.
not overwhelmed.
Yeah, you don't want to be storing.
Yeah.
all
Well,
this
I have a
stuff
big
for-
barn full of stuff, but it fills up quickly.
Yeah.
And yeah, so I accept donations. I used to clean houses, and when I would purge people's homes, they would donate whatever was purged
Right.
free.
Right.
And I still have those clients. I can call them up and say, hey, can I come over and do some purging this year? And they'll donate stuff. So there's no shortage of stuff to sell.
Great.
And my father-in-law, who's 90, is ramping down his workshop. He used to build furniture, and he makes whirlybirds, and we put the whirlybirds out. They're out there now. And he's decided to clean up his shop. So I've got men's stuff this year.
That's
like
exciting.
Yeah, like tools and wood and patterns and a whole bunch of stuff that you can do woodworking with.
Wow.
So, and then I flyer all over the place and I ask for volunteers, and it'll go out.
That's wonderful.
I'm going to put an ad in the paper, and I think Creemore is actually running it for me as well. A bunch of places.
It's great.
And every event I go to, I talk about it. So it's a lot of word of mouth.
Yes.
Right. I'm a talker, and I get people involved and like, okay, come on, help me.
Yeah, that's wonderful.
Yeah.
That's wonderful.
So, what else am I up to with respect to helping mental health? I hope to have my motorcycle ride again this year. We did one last year, and it was through the Steinhouse, but unfortunately they finally succumbed to COVID. COVID did them a number.
That's too bad.
But they still have a connection to a motorcycle group.
Okay.
And they want to do it probably late summer.
Nice.
And I'll be hosting that as well. Where we're hosting it, I don't know. But wherever I go, I'm doing my raffles. I run the raffle from April until October for World Mental Health Day.
Yes.
And I sell tickets for that. So that's another thing I'm doing to raise money.
Wow. You're busy. You're busy.
I am.
And you do your mentoring too, right?
Yes. Yeah, I do my self-love mentoring. I do intuitive spiritual readings. So the readings I developed from doing my own awareness through the literature that I read. And these books all contain messages that are good for your mental wellness, for self-care, for awareness. Mm-hmm. And I get people to choose a book by selecting it through their intuition. And once they've selected their book, then they randomly open a book, and then we read from there. And I share on them what I learned from that experience, and then what clarity or insight and wisdom can they take from it. And it's really fascinating.
That's incredible. It really is. Yeah.
And I always tell people, take what you need and leave the rest. I learned that when I went through Al-Anon. And, they were another big help for my mental health. Because you're dealing with either your codependency to an alcoholic, or you're dealing with your own issues about the alcoholic. And I suffered a lot through my family and relationships through alcoholism, and it was one of the major steps I took in my life to deal with my post-traumatic stress disorder. And I don't know if the Mental Health Association steers people in those directions. I like what your programs are for addiction and that, but.
So we actually operate under a harm reduction model.
Oh yeah.
So basically having the client lead the discussion and the treatment,
yes,
based on what they want to do and what they're prepared to do. And then we just focus on providing that support,
yes,
in the best way that we can. Yeah. So if a person comes to us and wants to, go to a treatment center for addiction, we would be able to facilitate and help with that referral. And then if a person comes to us and I would like to reduce my alcohol, can you help me with that? Then we would help them with that. It's whatever the client's goal is. That's what we support.
Nice.
Yeah.
That's important that it's well, it has to start with us. One of the things I learned in Al-Anon was let it begin with me. Right. So I always believed.
She wants to know
what
the
date is this event? The event
Your
of
event. Your
my
fundraiser.
event,
Yeah.
July 7th to 9th. I hope you can come, Liz, because I would love to have you here. I went out.
Have you met in person?
Yes, we have.
Okay.
Yeah, I went out there last summer to visit her.
Neat.
And it was great. I got to see. I've never visited Cornwall before. She's way out in Cornwall.
Oh yeah, that's far.
But I travel all over the place. My long-term goal is to get a trailer, a little mini trailer, like a 10-footer, and decorate it with my logo, because my logo is with a sad face and I'm angry, to a happier face with flowers in my hair where I'm growing. And then my last one is where I'm enlightened and I have beautiful sun hair and I'm smiling. And so I want to put that logo on the trailer. That would be
amazing on a trailer, right? Yeah.
I want to put that on the trail, and I want to travel across the country talking about mental wellness.
Wow.
Yeah.
That's fantastic.
And sell my books and raise money.
Yeah.
You know, that's my passion. This is my dream, right? My other dream was to open a center of my own. That was for, like, have you ever heard of what was the name of it? I volunteered there for a while. It's in Mississauga. Oh, the name's escaping me now, but it's a transitional home for women that have been abused.
Okay.
Geez, I can't remember the name of it. But I worked there taking care of the children. And it's a 6-month stay. And they get you back on your feet, and they get you off of welfare, and they help you get a job, and you have housing, and you have daycare, and they have a boutique, and it was amazing.
What a comprehensive program. That sounds incredible.
Yeah. I can't remember the name of it. Anyway, so I did that, and it just inspired me to, like, oh, if I could afford to buy a place and fund it, and everybody, you know, have that transitional place where they're struggling with their mental health. And like, I had that kind of help, right? I couldn't afford my rent and stuff like that. So it's sort of almost like, I don't know if it has a negative connotation to it, but like a halfway house where you're halfway. You want to get back on your feet and you're working on yourself to get there. But people sometimes financially, we just can't do it. Like, if I didn't have the help I had, I don't know where I would have been. Right. So I think there's more and more people out there focusing on that. I've got a few more guests that are coming on that actually have these kind of systems in place.
Wow.
In the States and stuff. So
great.
You want to watch some of these episodes.
I would love to hear about all of that. Yeah.
Yeah. And a lot of people working in the realm of mental wellness now. And the self-care thing is really growing.
Yes.
Really growing.
Yes. And you know what? It's so important, right? I think that, you know, years and years ago, there was so much focus on, you know, that clinical piece, right? So, you know, visiting the doctor, you know, looking at medication. And of course, that's a piece of treatment and it's important. But the things that we're talking about today are important too, right?
Yeah.
So, you know, I think that, you know, that looking after the whole person is so important. So if your mental health issue requires medication, that's important. But it's the other things that the person can do as well to try and keep themselves well, right? So it's people like you and other mental health warriors that are putting this awareness out into the world, that, you know, we need to love ourselves and we need to look after ourselves. And those messages are so important.
Yeah. Yeah. Well, I want to thank you so much for coming on. This has been really great.
Thank you. I mean, I like I said, this is my first podcast, and I just love how casual it is, and I hope that you know, everyone's enjoyed it, and I've had a lot of fun. Thank you for having me.
Yeah. So is there like, I think most people must know the website, but just share where the website is.
Yeah.
What the you know, if you have an email, people can reach you that they have any questions from today's podcast, or if they need to reach out to the Canadian Mental Health Association? What's the
Absolutely.
best way?
So the best way is our website, which is cmhastarttalking.ca. You can also Google it. Just look up CMHA Simcoe County. When you Google our name, you will see our website. We also have several social media platforms. So we have Twitter, Instagram, YouTube, LinkedIn, and Facebook. So we always are posting, what we're doing and what we're up to on our platforms. And our website, you can find information about all of our programs. You'll find my name under the volunteer program and fundraising, and my email's there, and please feel free to reach out anytime.
Thank you again, Lynn.
Thank you, Annette.
It's been a great experience.
Wonderful. Thanks so much.
You're welcome. So everyone, if you haven't subscribed yet to the Mental Health Warriors, please do so. If you are needing support and want to talk to somebody, you can reach out to Lynn or at the Canadian Mental Health Association or myself or any of us warriors. We're here to support you. And I hope you have a most fantastic day. Thank you so much for listening. Bye for now.
Bye.